Hi, my name is Amanda. I'm going to be your nurse today. Can you tell me your name and birthday?
Alex Peterson, 1270.
Alright, I'm just going to start by washing my hands with some hand sanitizer. We took your vitals earlier. Your respiratory rate's 18, blood pressure is 118/76, heart rate 74, normal sinus rhythm, temperature is 98.6, pulse ox was 97% on room air. Are you having any pain?
No, ma'am.
Okay. You're a diabetic. We checked your blood sugar. It was 81. Alright. I'm going to tell you 3 words. Have you remember them, and I'll ask you about them later. Apple, truck, and desk.
Okay.
Can you repeat those?
Apple, truck, desk.
Okay, good. I'm just going to start by looking at your skin. Do you have any wounds or lesions that you're aware of?
I do not.
Okay. General appearance is clean, intact, well nourished. Skin is clean, free of odor. It's warm bilaterally, even in tone. Patient is lightly suntanned. No wounds or lesions visible. No superficial veins or varicose veins present. I'm going to look at your skin or your nails. Nails are clean and well maintained. Capillary refill is brisk and less than 3 seconds in the fingernails as well as toenails. Okay. I'm going to look at your hair. His hair is thick. It's not receding. No lesions on the scalp or lumps or bumps. No dandruff or lice noted. He has a beard with light patches of gray spread throughout. His fingers, he has no signs of clubbing or cyanosis. Non-tinting skin over the palms. He's hydrated. Okay, I'm going to look at your head. It's symmetrical. It's relatively normal in size. Face is symmetrical with no unilateral deficits. I'm just going to feel and listen to your arteries in your head and neck. I'm going to start by feeling the temporal arteries, the +1, and the carotids one at a time. +2, +2. Using the bell of my stethoscope, I'm going to listen for any bruits. Take a deep breath and hold it. And again. Okay. No bruits are noted. That could be a sign of stenosis. Alright. I'm going to check your temporal mandibular junction. Can you open and close your mouth for me? Okay. And can you wiggle side to side? Okay. Got good range of motion. Trachea is midline. I'm just going to check your thyroid. Thyroid's within normal limits. Can you swallow for me? Okay. It's movable. I'm going to check your lymph nodes. I'm going to do the pre- and post-auricular, the retropharyngeal, occipital, the submandibular, the superficial and deep cervical chain, as well as the supraclavicular. And I don't feel any lymph nodes, which that's normal. No lymphadenopathy noted. Can you move your head around for me and turn side to side? Okay. No deficits or pain or limitation with any movement of the head and neck. And I'm just going to look at your jugular vein to make sure there's no distension. This could be a sign of fluid overload. So I'm going to have you turn your head to the side. Okay. This side. Okay. No jugular vein distension is noted. Alright, or carotid artery pulsations. I'm going to check your eyes. Eyes are symmetrical. There's no swelling or drainage. Sclera is white. Are you wearing any contact lenses?
I am.
Okay. Eyelashes and eyebrows have an even pattern of hair distribution. I'm going to have you check your visual acuity with the Snellen chart. We'll do that in the next video. Alright, ear. Look at your ears. Ear anatomy is normal. Looks like the patient had his ears pierced at one time. Is that correct?
1.
Alright. The pinna is normal shaped. There's no skin tags or deformities. Any pain whenever I'm feeling on your ears?
No.
Okay. The external canal is dry, clean, without any redness or lesions. Have you recently had any ear infections or hearing loss?
I have not.
Okay. I'm going to whisper in your ear. Can you tell me what I say?
1, 2, 3, 4, 5, 6.
Okay, so he passes the whisper test. It's normal. And that's it. Okay. Looking at your nose, I'm going to test the patency of your nose. So I'm going to have you hold one nostril shut, do a deep breath in and out, and do the other side. Okay. Nose is symmetrical without any obvious deformities. Let's check your sinuses. You having any tenderness when I push on you?
No.
Okay. Sinuses are non-tender, nose is patent when each side is occluded. Alright, now let's look at your eyes, or your mouth, sorry. Can you open your mouth up for me? Patient's not missing any teeth. Mouth is pink. Let's say ah. Okay, the back of the throat is free of any redness, swelling, or drainage. Lips and tongue are within normal limits. Okay. Now, an important part of the assessment is the self-breast exam. Men are also at risk for getting breast cancer, so it's important every month just to be palpating and making sure that you're not feeling anything abnormal, any lumps or bumps. So to do that, you're just going to put your hand up over your head. Do it after the shower, maybe when you have some lotion on or soapy water, and you're just going to want to feel and go in a circle, going in towards the nipple and up over your armpit. And just make sure that you're not feeling any lumps or bumps, and then just rub. Yep. Okay. You do that on the other side for me? Alright, good. Now I'm just going to listen to your lungs and check your thorax. Upon inspection, the anterior and posterior thorax is free from deformities, lesions, scars, or any spinal deformities. Can you stand up for me? Okay. Spine is straight. Can you just lean over? Alright. Again, no curvature, no abnormal curvature of the spine is noted. Rate and rhythm of respirations are within normal limits. Patient is in no apparent distress. No accessory muscles are being used or retractions are visible. So I'm going to start just by listening on the anterior. Deep breath. And again on the posterior. Listening to all lung fields. Can you forward for me a little? Okay. Lung sounds are clear throughout all lung fields. With palpation, there's no tenderness or crepitus. Okay. Can you say 99 for me?
99.
Again?
99.
Again?
99.
Okay. Assessing for tactile fremitus is present throughout all lung fields, which is a normal finding. Other signs of adequate ventilation are present. As I said, patient is in no apparent distress, no signs of cyanosis. Okay, and then I'm going to listen to your heart. Alright, I'm going to listen to your aortic valve, listening on the right second intercostal space. Also the pulmonic valve, the left second intercostal space. Erb's point is the left third intercostal. The tricuspid valve, which is the lower left sternal border in the fourth intercostal. And the mitral valve, in the fifth intercostal, medial to the subclavicular line. And I'm just going to listen to those again using the bell of my stethoscope, listening for a few cardiac cycles. And just checking for any murmurs or adventitious heart sounds. Okay. And you have normal S1 and S2 heart sounds over all 5 areas of the heart. I'm going to check you for edema. This can be a sign of fluid overload. So I'm just going to push. Make sure you don't have any pitting edema. There's no non-pitting edema noted. Go look in your ankles. Have you noticed any change in the way your shoes or socks fit? How many pillows do you sleep on at night?
1.
Is that normal?
It is.
Okay. No pitting edema is noted in bilateral upper and lower extremities. Okay. I'm going to check your pulses. Brachial. +2 bilaterally. Radial. +2 bilaterally. Get to these. Popliteal. Posterior tibial. And dorsalis pedis. And that's +2 bilaterally throughout all fields. All right. Can you remember the 3 words that I asked you to remember earlier?
Truck, an order desk,
Uh-huh.
and should write this down.
Apple.
Apple. Yeah.
Do you know where you are right now?
I'm at home.
Okay. And what year is it?
It's 2015.
Who's the president?
Barack Obama.
Okay. What month are we in?
September.
What's the next major holiday?
Oh, it was probably Easter. Halloween.
All right. So patient is alert and oriented ×4. What year did you graduate high school?
89.
Okay. And what did you have for breakfast this morning?
Just a cup of coffee.
Okay. So long-term, recent, and short-term memory is intact. Okay. Glasgow Coma Scale is a 15. So now I'm just going to check your cranial nerves. Can you close your eyes for me? So to test your cranial nerve number 1, your olfactory nerve, I'm just going to have you take a smell of this with your eyes closed. Can you tell me what that is?
Smells like peppermint.
Okay, so cranial nerve 1 is intact with no deficits or weakness noted. This is a box of mints. Cranial nerve 2, is your optic nerve that's responsible for your central and peripheral vision, and we'll check that with your Snellen chart. Cranial nerve 3 is your ocular motor. That's for eye and eyelid movement as well as pupil reaction. So let me check your pupils. Okay, pupils are equal, round, and reactive to light, 3 millimeters bilaterally. Let's see. Okay, can you follow my finger? Okay, extraocular movement is intact throughout all lung fields, no nystagmus. Okay, follow my finger. Accommodation is intact. All right. So cranial nerve 3 is intact with no deficits or weakness noted. Also, your cranial nerve 4, your trochlear, is also responsible for eye movement, as well as cranial nerve 5, that's your trigeminal. Alright, can you close your eyes for me? Alright. Every time I touch you, say no.
No. No. No.
Okay, so cranial nerve 5 is intact. Patient is able to feel. No deficits noted. Cranial nerve 6 is the abducens. That's also responsible for eye movement. Cranial nerve 7, facial muscles. Can you raise your eyebrows? Puff your cheeks? Can you frown? Can you smile? Okay. Cranial nerve 7 is intact with no deficits noted. Everything was equal bilaterally. Cranial nerve 8 is the vestibulocochlear, and we already assessed his hearing. Cranial nerve 9 is the glossopharyngeal. Cranial nerve 10 is the vagus. Open your mouth for me and say ah. Big. Okay. Uvula is midline with no deviation to either side. And you can swallow, correct? No evidence of drooling, so cranial nerve 9 and 10 is intact with no deficits noted. Cranial nerve 11 is your accessory. That's your skeletal muscles. Can you shrug your shoulders? Okay, relax them. Shrug them again. Okay, able to overcome resistance. Can you turn your head to the right? To the left. Okay, and back to me. Right. Okay, and left. Okay, patient's able to overcome resistance. Cranial nerve 11 is intact with no deficits or weaknesses noted. 12, the hypoglossal, is the skeletal muscles of the tongues. Can you stick your tongue out? Maybe right and left. Okay. Can you push your tongue against the inside of your cheek? Push against my fingers. Okay, again. Okay. Cranial nerve 12 is intact with no deficits or weakness noted. Musculoskeletal assessment. Alright, we're going to check your arms and legs. So your arms, hold your arms up like this. Okay. Pull against me. Okay. Push. Okay. And let me see you kick your feet out a little bit. Push like you're pushing on gas pedals. Okay. Point your toes up. Okay. No weaknesses noted on that. Let me see. Can you squeeze my fingers? Muscle tone and strength is equal and strong bilaterally. Alright. Can you close your eyes and put your finger on your nose? Okay, the other hand. Okay, good. I'm going to have you just get up and do a quick walk. Alright, gait is normal. You can have a seat. And I'm going to have you take your heel and just rub it down your shin like that. Okay, good. Alright. Let's see. I'm going to grab a pencil. Alright. close your eyes for me, and I want you to tell me if I'm touching you with something hard or pointy. I mean, soft, dull, or hard? No. Sharp or dull?
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Alright, sensory function is intact. Patient is able to differentiate between sharp and dull objects on the arms and legs. He's without any involuntary tremors or movements. Like I said, strength is equal bilaterally. Alright, can you close your eyes and hold your arms out like this? Close your eyes.
Oh, he said close your eyes.
Close your eyes. Okay, patient delays no pronate or drift, and can sit with his arms with no movement. Alright, gait is normal. Can you stand on one leg at a time? You can open your eyes. Okay, other foot. Balance is good. Okay. Now I'm just going to take a listen to your belly. I'm going to start just by inspecting it. Okay. No signs of hernias or any pulsations. Any tenderness?
Nope.
Okay. It's soft, non-distended, non-tender. I'm just going to listen to your bowel sounds in all 4 quadrants.
Got chili for lunch.
Good. Bowel sounds are present in all 4 quadrants. I'm not done. I'm also going to assess for vascular bruits. Going to look for renal. That's in the upper quadrants bilaterally using the Velma stethoscope. Okay, no bruits noted. Also the aortic. That's using the middle of the abdomen. Just above the umbilicus. And the iliac, that's in the lower quadrants bilaterally. Okay, no bruits are noted. Okay, that's it. Now we'll do the Snellen chart.